I am excited to welcome all of you here, both our panelists as well as all of you that are visiting. We are partnering with the Black OBGYN Project, and we are so excited to be able to bring this important conversation to you all. And so before we get started, I have a couple quick Zoom norms that I want to make sure that we go over, just so that we're aware before we come into the conversation. This conversation today will be recorded, and this recording will live in Period's media communication channels as a resource for the community to view and share within a couple of weeks. And so we ask you to keep your mics on mute when you're not speaking, and your image or name will not appear in the recording as long as your mic is on mute. If you do speak, your thumbnail or your video may appear in the recording as well. And if that's the case, you're welcome to inform us after the call if you'd like that to be removed. But the recording of Zoom takes the mic, so we want to be mindful of that. We will start a conversation today with a few of our panelists, and we encourage you all to engage with our panelists as well using the chat feature, so that we'll capture your questions, and we would love to get to as many questions as we can today, but we might not be able to. So we invite you to continue this conversation, take it online. You can hashtag Endo Warriors, Endo Sisters, and you can also tag @Period Movement and @Black OBGYN Project. We'll share those right now in the chat for your reference. If you'd like to post it on social. And after this recording as well, later this week, we will send an email to all of those who registered with any future contact information as well for our panelists, in terms of for some of our panelists, including just any sort of LinkedIn and things if we want to connect with them as an option. So just be aware of that as well, because we usually get questions about that during our calls. So without further ado, we'll go ahead and get started. And we're now recording. And so I'm very happy to introduce Dr. Rachel Bervell, who is our moderator for today. She's the co-founder of the Black OBGYN Project, as well as a resident physician herself. I will hand that over to her, and welcome all. We hope we have a wonderful time today. Thank you for joining us. Dr. Rachel, take it from here.
Perfect. I am so thrilled to be here. This is amazing. What a beautiful panel, filled with Black women, women of color, speaking just openly about experiences with something that we don't talk about often enough, which is our reproductive health, our wellness. As was just introduced, my name is Rachel. I'm one of the co-creators of the Black OBGYN Project, which is a space on Instagram, and it's grown beyond my wildest belief. I'm also a medical resident that's super passionate about education in different ways. And so this evening is really about educating one another. I know that we have a beautiful group and that this is going to be recorded on the Period website, but we're really going to talk about understanding what it means to name an invisible illness. And this invisible illness is endometriosis. I'll let the incredible doctors who are on the panel discuss more about that topic, but together we're going to listen and hear the experiences from patients and advocates as they reclaimed their health, which I think is huge, especially in the face of pain, discomfort, and even in some cases, maybe not being listened to right away. So our event today is more or less going to be broken up into 3 or 4 sections. For the first maybe 10, 15 minutes, I'm going to turn the mic to Dr. Debessai, who's an OBGYN resident, and Dr. Vilasagar, who is a minimally invasive surgeon. She's focused as well on endometriosis care. They'll kind of provide us a framework and the facts about endo. And then we're going to listen to our incredibly brave and beautiful patients, including Nenji Yilpet, who's an educator and a leader, as well as an author and naval officer, Alana Abernethy, who is, they both have lived with endometriosis, have very different stories, but they're going to share their experiences, which I think is so important for all of us to understand that we kind of navigate health spaces, but feel alone. And so they'll kind of help us not feel alone. And then finally, we have organizations like Filling Empty Wombs, which was founded by Sandra Eidor, who herself is an endometriosis and infertility patient and advocate, as well as Doris Murimi. She's an author, an adolescent and menstrual health advocate, and the CEO of Endo Sisters East Africa. She's actually calling in from East Africa where it's 2 a.m. in the morning. So we just want to say thank you to all of you on this panel today. All of your lives have been changed in some way, shape, or form because of endometriosis. And so we're going to end the talk with this, like, you know, in a way, red table talk like experience where we're just going to bring together the facts and experiences and try to understand the role of reproductive justice, you know, reclaiming our health and our wellness, because that's really what matters. So, you know, enough about me talking. I think we should just start in, and actually going to direct the first question to Dr. Debessai, you know, starting from the basics. What is endometriosis? What are the symptoms? You know, what kind of patients are coming to you? What are their complaints? And I think you're muted, so.
I am muted, yes, thank you. So endometriosis, so this diagnosis or this disease is actually, it's a really hard one to nail down for our patients, which I know is not a surprise to a few of our panelists, but it's typically the way that it happens is it's usually endometrial tissue. So your endometrium is a layer of the inside of your uterus you shed every month when you have your menstrual period. And what can happen is certain glands from that tissue and from that endometrium can actually be found in other parts of the body. And so that tends to be what is defined as endometriosis when they find that tissue in other areas. What's unfortunate is that this tissue actually responds to your hormonal cycle, just like your endometrium. So typically the patients that suffer from this diagnosis typically end up having cyclical pain. They usually end up with pretty severe menstrual pain or premenstrual pain, usually right before their onset of their menses. And it can be in where those implants are. So sometimes that'll be on the bowel. So they'll have some GI distress. So things like constipation, diarrhea. It also can be on other areas and other pelvic organs. So that can cause pain with sex. And it can actually lead to scarring and adhesion as well. So it can be extremely uncomfortable. And it can turn into a situation where it's not just uncomfortable and painful during the times that you're on your periods, but all the time. And so I can share the floor here with Dr. Vilasagar if you want to add more, but it can be a pretty debilitating diagnosis. And I know, at least on the resident standpoint here in Atlanta, we see a decent amount of patients with this diagnosis, and it actually can be hard to nail down. And I'm here to also learn from the panelists about their experiences as well.
Yeah, I think that was great. I'd love to add to that. So you're absolutely right that it's cells that are acting like the cells of the endometrial cavity, the glands and stroma there, and those endometrial-like cells can implant elsewhere, causing this huge variety of symptoms. And there's overlap of symptoms with endometriosis and other conditions. As you mentioned, sometimes it can be confusing. I think you went through a lot of the type of symptoms that we see. And to add to it, we know that this causes the systemic inflammation that can then lead to overall fatigue in general, significant bloating that women experience, nausea, vomiting, GI symptoms, pain with just eating in general, even like a mental fatigue, mental fog that can happen. And we traditionally used to say it's associated with your period, is cyclically with your period, with the cycle and hormone fluctuation. And we see that it can spread beyond that too for multiple different reasons, and chronic pain conditions can set in. So we see a huge symptom overlap. I think it can make it confusing for many people to diagnose because they might present with GI symptoms or infertility. Alternatively, we see this huge spectrum where women may not have pain and they present with difficulties conceiving or becoming pregnant. And then that leads to this continued delay in diagnosis because that's not a reason alone maybe to go to surgery, which is the definitive way to diagnose it. So we see huge variety of symptoms and overlap. And I think it's important to note that it can be anywhere on that spectrum for any of the women. And I love to hear from the other panelists and patients too who have gone through this. But yeah, that was great as far as what it is.
Yeah, you know, I'm going to turn the floor in a moment to Alana and Nenji to kind of share their specific experiences as patients. But it sounds pretty debilitating in terms of this key symptom being pain. And so I want to know, Dr. Vilasagar, you know, is there a cure? You know, so a patient comes to you, you've diagnosed them with endo. We'll kind of skip the diagnosis process. I want our patients and our advocates to talk a little bit more about that. But is there a cure, and how is it managed or treated if someone comes to you with that diagnosis ultimately?
Yeah, there's no absolute cure for endo. So we can't say, here, take this medicine and it's going to, you know, regress or dissolve these lesions. We wish, but these cells that implant elsewhere and are causing this growth cause this surrounding inflammatory process, scarring, fibrosis. So we have to remove the disease and remove that other scarring that's around it, because eventually the pain can be caused by that distortion too. So when we talk about a cure for it, we you know, the thing that is most like a cure is removal or excision of this disease. So that's going to offer the most optimal long-term outcomes of pain relief and improvement, optimizing fertility. Also, removing that inflammation up front is going to help in the future for fertility, or currently, if that's a goal. And it's also going to give the diagnosis. So we know we can't diagnose endometriosis. We can suspect it based on symptoms. We can't diagnose it until surgery. We remove it. Those specimens go to the lab, they get tested, and it's confirmed that way. So while there's no cure, again, that we can do this, and, you know, gosh, even after full excision surgery, it's a chronic condition and it can come back. So there's no way to stop that, unfortunately. When we do intervene, we're intervening because of symptoms. Again, that debilitating pain that's affecting quality of life or fertility goals. So when we do that, we want to tailor treatment for a patient, but then also talk about maybe managing symptoms downstream. And so medications can help with that. Again, symptom management. Unfortunately, they're not going to stop progression or recurrence of disease. You know, some studies have shown some medications can prevent recurrence, but again, there's nothing that's going to be an absolute cure.
That's so fascinating, you know, especially in medical spaces where we consider everything to kind of have an answer. You know, March is Endometriosis Awareness Month, which is why we are all here. I see Doris is wearing yellow, which is the color of endometriosis, you know, but it's something that I myself had no clue about until, I mean, I entered OBGYN spaces, to be honest. I really didn't know what endo was. And I didn't know that March had, you know, it had its own month, which is March, until, you know, I started being in this space as part of the Black OBGYN project. You know, statistics say that endo affects 1 in 10 women and girls of reproductive age or reproducing people around the world. You know, and we have an idea now how endo is treated, but Nenji and Alana, you know, you're listening to these doctors give this amazing explanation. Everyone, I see some comments in the chat, people asking questions as well. And I encourage you to continue asking questions in the chat as because we'll get to them later on. But Nenji, you know, I want to hear what was your story? How did you get your diagnosis? Because Dr. Debessai talked about how people present. And then we heard Dr. Vilasagar talk about how to get rid of it in a way, even though there's no cure. But how did you learn about your diagnosis?
Great, thank you. So yeah, my journey with endo. So I've been an endo patient and advocate for about 7 years now. And my journey with endo, thank you to both of the doctors. Your explanations were so spot on, and I wish you'd been my doctors at the beginning of my journey, because I think I had a lot of the symptoms that were named, right? And so back in about 2014, my periods had gotten really, really bad, debilitating almost. I ended up in the ER 2 times. I was just on the ground and I couldn't get up. Like nothing would stop the pain, right? We're talking about everything you do, like over the counter, you know, laying in a hot tub, heating pad, everything. It's just like someone was stabbing me and it just would not stop. really, really scary. It just felt like, okay, I can't live through this, right? And so I had some really great family members who rushed me to the ER, which was the first time I ended up getting an ultrasound. And on that ultrasound, they found 2 tiny fibroids. And so it was just then assumed like, oh, the fibroids must be causing her pain. So then I went to go see an OBGYN, and I saw probably about 4 or 5, and they, everyone would put me on like a birth control, hormonal birth control that was pretty strong, because what was initially given to me didn't work. And I was like, this isn't changing anything. I'm bleeding for 21 days, 28 days in the month, like, and I'm in so much pain. And then eventually it took about 8, almost actually 10 months. And they finally were like, okay, well, it just still must be the fibroids. We'll just go in and do a really invasive surgery to remove the fibroids. And looking back at it, it wasn't the fibroids, because there were 2 little ones that were like maybe 2 centimeters. So they weren't that big. Again, I know positions of fibroids can cause discomfort. I don't want to negate some of the symptoms that may have also been showing up from that. But in reality, the pain wasn't connected to that. And only one nurse practitioner that I saw in those whole 10 months actually said, that pain doesn't sound like fibroids. Have you heard of endo? And I was like, I don't know what it is, right? But then I looked it up, and a lot of people were like, oh, mainly white women have that. It's probably just fibroids because Black women have fibroids, and that's just what it is. So I went under the knife for a really invasive surgery, a myomectomy, which is where you go to remove fibroids, not even a laparoscopic one, which is really huge as a 26-year-old at the time, and just like, why am I going under such a big surgery? But again, I didn't know, right? I had no sense of how to advocate and what was going on. And so when they went in there, they found out I had stage 3 endometriosis, and my entire like right fallopian tubes and ovaries don't work. Like everything was so clogged, and like my organs were all stuck in all the different wrong places. And so they did the best they could to unstick that. But because they weren't coming in, I mean, the purpose of the surgery wasn't for that. They removed the 2 little fibroids, but they didn't actually do an excision surgery. Like the surgeon at the time didn't know how to do that. I hadn't consented, all those things. So yeah, that's how my diagnosis came. It's a very passionate story because there was just so much pain involved. And again, going under the knife for something that wasn't it, but I did get an answer to the pain. And since then, it's been a lot of managing symptoms, and you may get to a question on that as well, so I won't jump into that. But that was my diagnosis story, was literally going under the knife for something else. But then they're like, oh, but nobody had thought that, nobody had really listened to the pain aspect, which was the main symptom, right? Like for me, I was like, I'll deal with the bleeding, I don't care. But like, I can't live in this type of pain. And it was just assumed it was the fibroids, because that's what you could see on an ultrasound. Because as both of you have said, you can't see endometriosis on an ultrasound. So, but when they went in there, they figured out that that's what it was. And then we began taking treatment steps after that. So, yeah.
Wow. I mean, I'm just watching, all of our heads are just bobbing up and down, because we're like, you hit so many things that we're going to get to. Number one, this myth that Black women don't get endo, which is not true. Number 2, this not being heard when you're in pain, and going in. Number 3, for something very invasive, a major surgery, and not really having good direction in the beginning to know even what this disease is. Alana, I know your story is a little bit different because you were diagnosed with endometriosis more recently. So I'm curious, how did you learn what endometriosis even was, and how have you gone on to manage it? It sounds like Nenji's managing it mostly just kind of post-surgery, and kind of symptom-wise, but how are you living with endometriosis?
So I was diagnosed in September of 2019. I've always had heavy periods and also painful periods, but it was about 3 years ago where that shifted, and it was excruciating. Like I said, sorry, I was reading a comment and a word popped out at me. It was just like needles just clawing at your uterus. And I knew something was wrong. As I've said, I'm in the Navy, and I was on a ship leading a department. And so having a painful, debilitating period every month, though it's not something we should sit in general and accept, I just couldn't hack that on the ship and still perform my duties. So I went, scheduled an appointment, told the gynecologist that I was having this pain and that it had changed from what it was before. And we went with, well, we'll just take Depo. So I kind of just wanted my period to stop, threw a Band-Aid at it so I could continue to hustle and do my job on the ship. And it caught up with me. Ooh, it caught up with me. It was literally the day before my birthday in 2019. I had a pain flare that I've never experienced before. And I have experienced, they've gotten worse through that time, but not knowing what was going on, but I was still being stubborn. I said, I just feel like I ate bad food. That's kind of how it came on, like stomach issues. And I felt like I had to go to the bathroom, and then it exploded. And so I had a friend take me to the ER the next morning, and I thought my appendix had burst. It was just excruciating. And so that's why I ended up going. I was like, I really need to go take care of this. And they thought the same thing. So I went to the emergency room, they did a CAT scan. And the doctor came back and was like, well, you have a 10 centimeter size cyst. It was to the point that it was wrapping around the back of my uterus. And so I actually, in 2006, I had a 9 centimeter size cyst identified when I was in my freshman year at the Naval Academy. And my roommate, Laura, is actually here listening. She helped me recover and get through all of that. So it was kind of familiar territory. And I'm like, oh, well, here we go again. Another cyst. It was a good run of years before this has presented itself again. And so it's another cyst. Let me go through the surgery and bounce back like I did before. And so we scheduled surgery laparoscopic at Balboa Medical Center here in San Diego. And when I came out, the pathology came back. And my doctor, he's a gynecologist, oncologist, my surgeon, and he goes, it was endometrioma. He's like, you have endometriosis. I was like, okay, I didn't really know what that meant. My mind was really in getting back to the ship, getting back to my duties, which I have so much perspective on that now, that your health truly does come first. And so I remember asking a question, hey, is there a possibility of this coming back? And he said, there's a possibility. And fast forward 5 months later, I was out on deployment in the Pacific Ocean, and the pain onset again. I pretty much had been in pain, it felt like, since surgery, but I was kind of managing it. And then I had to go to the emergency room in Yokosuka, Japan, and they did an ultrasound. And, kind of in your internal ultrasounds, they're just taking a little too long to do what they're doing, really kind of searching around for things. And I looked at her and I said, I know something's up. And so another doctor came in. During that, they were looking at it. I had cysts, I had the endometriomas growing back, I had fibroids. Fast forward to actually March 1st of this past March 1st, I had my second surgery. I was fighting to go through fertility treatments this whole time. That's why I was delayed. So it was literally March to March. I left my ship in March last year. Came back, had surgery. I was able to go through a fertility cycle, get a couple eggs, which was a blessing because my numbers were low, and they told me for months they didn't recommend that I do the cycle. And here we are. Sorry if that was long, but that was my journey. And now I have much more of an appreciation for what it is and how important it is that I need to be deeply involved in my wellness with this.
Absolutely. Wow. For the both of you, I just want to say thank you. And I saw a couple comments in the chat also expressing this, but first, appreciation for you sharing your stories. They're so different, both of them, but yet they are so touching and they're so real. They help put a face to a chronic illness, a disease, I think one thing I heard in both of your stories was this sense of almost isolation at the beginning of your diagnosis. Someone's telling you have an endometrioma, chocolate cyst, or someone saying, oh, you might have fibroids, and going in and telling you, oh, you have endometriosis. Neither of you knew what that was. And I'm so glad on this panel, we also have some advocates and organizations. And so I'm curious for the organizations, when you are hearing these stories from Alana and Nenji, and you're hearing the definition from the doctors, how are you trying to bridge between bridge the education gap, really. You know, first, Doris, why don't I have you kind of tell us about your organization, and then like what you are trying to do to help people like Alana, Nenji, maybe some of the people in our audience who don't know they have endo, learn or know what endo is before they get the diagnosis.
Okay, thank you so much. Yeah, I'm also an endo warrior myself. It took me 30 years to get my diagnosis. So that's actually the reason why I started Endo Sisters East Africa Foundation. So the organization is based in Kenya, and it's a social advocacy organization. And we focus really on two things, two areas rather. One is community awareness activities, and that's like education, exactly what you're saying. We focus primarily on adolescents. We really target because we know it's, talking about endo early is important because it helps in mitigating and managing the disease better. So we talk to students, to, those in school. We talk to college those in college and university and youth groups and all that. And then the other thing we also do is a lot of social media. We do a lot of TV interviews and speaking engagements. We're involved in those sort of discussions just to get the word out there. We also have a campaign running known as the Yellow Nails, #YellowNails movement. So we paint our nails yellow, and it's just sort of exciting and making it interesting for young girls to want to come out and identify and learn more about it. And even the ones who are diagnosed at that time, it's something positive to kind of relate to, and to kind of want to be associated with. So we started that as a fun thing, and it's actually, many women, especially here during endo month, will paint their nails yellow. The other thing that we do is we focus on advancing social justice for women. And so but by doing that, some of the initiatives that we've done, for example, is we've managed to have menstrual education, menstrual disorders education included in our school curriculum. I mean, that is like huge because many of us, even listening to the stories, people hadn't had of endometriosis before. So so we just had it put in, and so yeah, it's going to start from grade 6, and the kids will be taught about menstrual disorders. I mean, they'll get to learn about the different, endometriosis, fibroids, adenomyosis, everything, so that they then have some understanding and they're able to identify the symptoms that they're having. The other thing under social justice that we're doing is books. Is just we have a book that's out called When Something Is Wrong. Actually, that's just getting launched tomorrow. But we also have yes, and then we also have another free booklet on our website that's on demystifying endometriosis, and those are the whole issue of that it's a Caucasian disease, that kind of thing. We demystify, we debunk those kind of myths. And then we also have a guide for for those people, because we can't manage to to do the outreach training to everybody. So what we do is train some people and then get them to go and talk to other communities in far off places, and especially the countries, neighboring countries where we can't really get to. Yeah, so that's pretty much what we do. Oh, and I shouldn't forget to say that one of the other initiatives that we've done is collaborated with our obstetrics and gynecology society, and we've gotten an opportunity to appear at one of their meetings and actually talk about the human face of endometriosis. So we have made, we've spoken to them and told them, let them see how we feel, and let them see us rather not as patient number 19 or patient number 2 or 4, but as daughters, sisters, mothers, wives, and just tell our story, and also say what we expect, the kind of treatment we would want, the kind of advice, the kind of holistic. As Dr. Smitha mentioned, that it's it's a systemic disease, so that holistic sort of approach in terms of treatment. Yeah, and also the guidance to and direction towards support groups, because we have a number of support groups existing. So yeah, thank you.
Wow, yeah, you are doing so much, and I can imagine Alana and Nenji, and Sandra, if you had gotten this type of education before your diagnosis, it would have probably changed the way you approached your management of your disease. Another component I'm sure that you teach, Doris, when you are going out into the community is how endometriosis is not just about painful periods. You know, I think, you know, both Dr. Vilasagar and Alana mentioned how it impacted fertility. And I'm curious for you, Sandra, how, you know, with that on our minds, how did your personal experience with endometriosis influence the creation of Filling Empty Wombs?
Hello, guys. Thank you for having me. Can you hear me? Okay, great. Well, Filling Empty Wounds came about, of course, because of my own story, my endometriosis story. I was the one that I started my menstrual at 9 years old, and I haven't even had the talk with my parents about menstrual yet. And here comes this blood that just won't stop. So now, as I'm getting older, I can never remember when I had a menstrual that wasn't painful. The only time I can remember is when a doctor put me on birth control. But what drove me to start Filling Empty Wounds was the fact that growing up with endometriosis, not knowing that's what I had, because it didn't make sense. No one around me had it. I was the only one. My mom didn't have it. I don't have any sisters, but I don't have any cousins, also distant family that had it. But my mom knew I was not lying, that something was wrong with her daughter. Every month I had a day or two, sometimes 3, of me throwing up, me having bowel movement, having issues just to stand up because I was so weak. I passed out before. It was pain. And at that time, I didn't have children, but I'm like, this has to feel like labor pains. This has to feel like labor. It didn't make any sense. So now, every month we was going to the ER, going to the doctor to have it checked, and every single one of them would tell my parents, she's lying. There's nothing wrong with her. She's asking for attention and she's just making it up. And I'm like, I don't understand. I am in pain because if I'm in school, I call out of school. I have to make arrangements with my workers as I get older. It's like, listen, I'm gonna need you as a backup for me because this is the time I'm supposed to have my menstrual, because I know I am a liability to whatever company I'm working for because the pain is so bad. I can't stand up enough to work for you, yet alone to take care of myself. So from there is because the lies that everybody was telling me, oh, she's lying, there's nothing wrong with her, that impact the drive of Filling Empty Wounds, because it took 21 years for me to be diagnosed with endometriosis. And when I was officially diagnosed, it was because of mistake. My husband and I, we were high school sweetheart, we got married, and we wanted to have children right away. Right away, we wanted to have a honeymoon baby, and it wasn't working. A year into it, my doctor decided, okay, we've been doing this for a year now, let's start Clomid. So we did my first month of Clomid, and I was getting pain. And I called, am I supposed to have pain taking Clomid? She's like, no, you're not supposed to. So I'm like, okay. She said, let's wait for another month to see what happened. So we waited another month, and the pain this time was even worse. So she brought me in, did an ultrasound. I had a cyst on both sides, on both of my ovaries. She said, wait a month, let's see if it goes down. Well, the right side got bigger. So that's when we decided to have surgery to check at those cysts or remove. Well, that cyst was actually a grapefruit size of a chocolate cyst. And at any point it could have burst, but it was just sitting there. And years prior, I didn't know that was a correlation. I've had bad constipation. I've had colonics done and nothing would relieve my constipation. And that was because that cyst was literally sitting on my colon. So we had the surgery, came out of it, find out I had stage 4 endometriosis. All those years, it was just collecting. Find out months later, I'm like, well, now that we got that done, can we have children? Went to get an HSG done. And both of my, she removed my right tube because it was crippled as if you crippled paper. and my left tube was left and nothing was going through. It was completely blocked. So now I'm in the doctor's office and hearing that the only way I have children was through IVF. So I had so much mixed emotion because I'm like, if only the doctors listened to me way back when, or if they did something, or just give me an extra 15 to explain everything, I would not have to go through infertility. So because of that, I empower women to advocate for themselves. Learn about whatever you are going through and fight for them to listen to you. I was younger, so fighting for my issue went as far as my parents. But my parents wasn't knowledge about this as well. And I'm Haitian. My parents are from the Caribbean. This is foreign to them. So I can't even blame them for something they didn't know. But now providing women that you don't have to go to the extent that I had to go through in order to be heard by your doctor, in order to advocate for yourself. Because yes, infertility is not the end result, but if we could avoid it by getting diagnosed early on with endo or other PCOS, fibroids, whatever it is, if we can get diagnosed early on, maybe you won't have to go through a route of infertility, especially here in the States. It is expensive. And especially women of color, if you don't have that disposable income, we can't afford it. We can't afford to get out of work to go to multiple doctor's appointment. We can't afford to expend our families due to the lack of funds and the lack of knowledge. So that's the reason why I created Filling Empty Wounds, because our goal is at some point we're starting to become a nonprofit. By the end of the year, we'll officially be a nonprofit organization. And we want to fund, that's our main goal. We want to fund families to expand their family, either through adoption or going through infertility treatment. And we are giving people the tools they need to provide that service to themselves or to others. We're starting the process to launch an ambassador program that these women, what I hear all the time is that no one understand, no one are around me, no one, I can't explain this to anybody because I'm being shamed. I feel it's taboo. So I've created an ambassador program where we train these women, like we're gonna teach you how to advocate for yourself, and you're gonna go out and help others in the journey to advocate for themselves. But the main part is to create that sisterly bond, to let them know they're not alone, because we don't have to be, because there are millions of us that's going through it. We just go through it silently, and we don't have to. And I tell people, cancer wasn't something that everybody talked about years ago. But because more people came out and told their story, now cancer is nationally recognized. Someone will stop to hear someone that explains their cancer to someone else, not so much endometriosis, not so much infertility. So to remove that stigma, we have to feel empowered to speak about it, regardless of how other people may perceive us. So that's one of our agendas for Filling Empty Room, to advocate, teach you how to advocate for you, and then to go along to advocate, help other people advocate for themselves.
Absolutely love that. I absolutely love that. You also kind of open up this next part of the discussion, which so beautifully, I think both the work that Doris is doing and you yourself are doing, Sandra, really help create communities for education for others, whether they have endo or not, education for patients, and then education for physicians. You know, how should we be approaching you when you come to our consultation room and our exam room? You know, I'm curious, since you kind of opened the door, Sandra, for Doris, Alana, and Nenji, how has your journey with endometriosis changed or altered your relationship with your physician or healthcare systems? And then after the three of you kind of answer that to Dr. Haben and Dr. Smitha, I want to know kind of how are you going to react to the things that they're about to say? You know, how can we change healthcare as doctors and make it more welcoming to our patients who oftentimes don't feel heard? So I guess first, for the patients on the panel, how has having endo changed your relationship with your doctors or providers?
So I'll go ahead and go. The Navy medical system is an addition to a different culture when it comes to medicine. With the Navy, just in general, as far as, you know, the military, you suck it up and you continue moving on. So we already have that problem with women's health in general in society and how we approach women's periods and all of their health. And then you put the added portion of the military aspect of suck it up, continue moving, take some Motrin, you'll be all right. And I subscribed to that for way too long. Even with, at the beginning of my career, going through what I went through with my dermoid cyst, I sucked it up and I pressed on. I actually only got a week of convalescent leave after that surgery, and they had cut me 10 centimeters on the bikini line and kind of pushed me back. I started going to school and doing everything that I could at the Naval Academy. And I subscribed to that for that whole time, for those 14 years, I think it was, and would just trudge through everything and suck it up. And it's the diagnosis with endometriosis. And I can't even say the diagnosis, but the reoccurrence of it after my initial diagnosis, where I realized I had to make a change. This is not something you can just push through. This is not something that I can ignore to just continue along in my career. It takes over everything. As it's being invasive in your body, it's invading your life and your mental and how you feel about yourself as a woman and a professional. And I just feel, it's ravaged my identity, and I've had to rebuild that. And so I've become more vocal in the medical system. I've had to, and being in the military, I am very aggressive and militant when it comes to a lot of things. But interestingly enough, when it came to my self-care, came to telling doctors what I need from them to be okay, it was a block. It was very hard for me to do that. I felt like I was asking for too much. I felt like I was being difficult at times when they kept on telling me, we don't recommend you for fertility treatment. Your numbers are too low. We don't recommend you. We don't recommend you. And I have one ovary, so I had my right ovary removed in that initial surgery. And so they just kept on telling me no. And I kept on saying, well, I want a second opinion. And I just kept on pushing and pushing and pushing. And it's not like I was out there like some warrior and had my shield and my sword and was just pressing through all of that and blazing a trail. It was hard. It was exhausting. There was times where I thought that was what was going to break me, is because I'm already dealing with all of this. And now I have to fight the people who are supposed to be helping me. Now I'm doing the research. I'm finding out certain treatments. I'm finding out the next step. I'm asking the questions. I'm pushing. When at that point, I really needed someone to care for me. Not just treat me, but also care for me. Because I was finding it hard to care for myself and to have that energy, while, like I tell friends and family to explain it to them, like I was on essential systems only for a long time. Like I did not have the energy. I was just trying to be okay mentally, physically, get through the day. So that was my arc. That was my journey. I've had to speak up more and to bust through whatever societal norms and military norms that I've been conditioned and have put in place, thinking that there's something wrong speaking up for yourself. There's something wrong asking for what you need, that the first pushback you get, that's where you stop. Because I don't do that in the way I operate in the military. If someone says no, in that sense, it's like, oh, okay, well, let's get creative and figure this out. So that's what I've had to apply to my health. Let's get creative and figure this out, because I'm not okay, and I'm not okay not being okay right now.
Powerful. Nenji.
Yeah, just adding on to, thank you for everything you said and how you shared that. I think for me, on a very practical level, even though it's actually 6 years this May since the diagnosis, but having had symptoms for years prior to that and just not even knowing, which I really appreciated when Sandra was going through the symptoms she had, and just to tag on that, the awareness of which I wish I had had earlier, right, of those symptoms, because I would have communicated those so much sooner to doctors. And so I think in a couple ways I'll answer this question. I think one would be on a very practical level, documentation. Like even to this day, when I've changed jobs and I have new providers, I still literally take the printout from Kaiser in Southern California that showed my diagnosis to any doctor I go to. I also have been documenting everything, right? As someone who's still trying to find ways to manage her treatment. I document my cycles. I document how, I take continuous birth control to try to eliminate cycles at times, because if I do have a cycle, even now it's completely debilitating. Like I will have at least 2 or 3 days where my legs are just, inflamed, and I'm on hot heating pads for the whole weekend and I can't really move around. But I'll talk about what my breakthrough bleeding, like everything I just document, right? And that's one of the biggest things in my personal and professional life with people I advocate for. I'm like, document everything, because 26-year-old Nenji was in those 10 months of seeing so many doctors, would walk in spaces and I'd be like, hey, I'm still not feeling well, or hey, I've been on this for 3 months, it's not changing anything. And like, oh, okay, we'll just up the, again, there was a lot of minimizing of the pain. And I'd go back in my car, and not even as a crier, I've said this before, but I would be like, I feel so alone, I don't get it. Like this isn't fixing the pain. And so just documentation has just been huge for me as a tool to help me when I'm in front of a new doctor or a new space, to say, hey, this is what's going on. Here are my symptoms. Like my bowels have been like out of control. I've literally been 3 weeks straight this month where I just have had flare-ups. My endo belly flare-up is so like, I can't find a way to bring it back down, or whatever that is, to just be really intentional in giving dates, timelines, everything. It sounds like a lot, but it's all in my phone. So that, because that way I've found I've been able to get more of I've been able to push back if it's minimized, right? It's like, where's the evidence, right? And, doctors are like, oh, what's the pain scale, 1 to 10 or whatever it may be. I'm like, oh, it's 15. So like, we need to like, can we brainstorm and find some other solutions, right? And so again, on a very practical level, I tell people all the time, even friends I know right now who are going through reproductive situations, trying to either get diagnosed possibly with endo or fibroids or PCOS, I always say, go in with your list, because it can feel scary and intimidating anyway, because you don't know, right? And there's you get there and you may be nervous and you don't know how to quite not even push back, but really just name, this is what's going on with me, and I really need to walk out here with a next step, that isn't just, okay, well, it sounds like this, let's wait 2 more months. I know in some cases that may be what has to happen. But I think for me, I always feel better now, like now in my 30s, of like, I did my due diligence. I listed everything. Or once, I was having sharp pain a year ago in my left ovary, really bad. It's my only ovary that ovulates right now. And I was just like, I went in, I was like, okay, I'm going to ask this new doctor I need an ultrasound. Because there either could be a cyst, I need this. So I walked in with 3 things, and I walked out with all 3 things I wanted, right? But in my early 20s, I would have never known how to do that. I would have just said, and again, all the things the doctor agreed with. So it wasn't just me like dictating, like this doctor knew what she was doing. But again, I just think on a very practical level, that self-advocacy and being able to document and express your symptoms in a way that allows hopefully the doctor to understand the severity of it, I have found has helped at least get me towards more actionable steps than in those early years where, again, I would wait, you're anxious, you get your appointment, and then, it's 10, 15 minutes. And it's like, oh, okay, well, I guess we'll just have to, and again, which was so discouraging, especially again, like everyone's named, for such a debilitating illness that impacts our entire lives. I think the last thing I would say too, and I don't know that this is, or I haven't seen it addressed when it comes to sort of the medical field of doctors I've connected with, but it's even just referring or helping your endo patients with their mental health, right? There's such a deep mental health toll that this takes on your mind, body, and spirit. And I've been fortunate in this last year to have an amazing therapist who I've actually been able to process some of the severity of the pain and just like the experiences that, whether it's the depression and being like, I have to deal with this for my whole life. Like, like I had these plans, and then like, everything just feels like it's falling apart at times. And so I think just even that piece too, and I know it's not necessarily always in the medical realm of like the doctor to be able to recommend that, but I do think there's something to be named about being transparent, like with your medical professionals on the impact on your mental health and documenting that. Because I've started doing that too. I'm like, oh, I went to a really in a really bad depressive space during this, flare up, and I know my hormones are adjusting, like, are there things you can suggest I can do? Or are there things I could recommend to my therapist to process with? Or pelvic floor therapy is something I'm beginning to try to hopefully get to learn more about, because I've heard it can have a lot of benefits. And I think there's a lot of tension and trauma sitting in my pelvic floor as a result of this illness. And so, yeah, I would just name those two things. But I think, again, the advocacy through the documentation, and then even just being honest with your doctor about the mental health toll, and trying to find recommendations and referrals in that way, so that you can holistically, get the support you need to manage endometriosis. So, yeah.
Doris or Sandra, anything to add?
I can chime in. One of the ways that I tell others to advocate for themselves is know your facts. You go in and know your things as well. Well, I know you mentioned it, but sometimes I say, don't tell your doctor just yet. Like, tell them your symptoms, but don't tell them what you want, in a way, because you want to know if this doctor able to tell you these things that are needed for you. Because I used to do that. I used to tell them, I need this, I need that, I need that. And they'll just go with that. I'm like, but I'm not a doctor. I may have missed something. So I'm gonna give you all of my symptoms. But I know, okay, based on this pain, I need an ultrasound, but I may not mention it right away, because I wanna see, are you going to offer an ultrasound? Because technically this is your field, not mine. I just know my symptoms. Because you can probably, like, you know what, based on this, let's go something further. And I would not have thought of that. I'm like, oh, okay, I like that idea better. So it's almost like you giving somebody paint, a paintbrush and a tile, and saying, go ahead, free draw, so I can see what you're gonna come up with. So I've done that, and I realized that's like, okay, I like you as a doctor, because you're giving me the tools I actually need based on what I've been searching for. And another thing I would say is, like, I gotten to a point when I've had some amazing doctors. A doctor that helped diagnose me, I loved her. But then it got into a point that she was too busy with GYN. She couldn't no longer do the GYN, but she was doing more OB. And it got into a point, I know I have endometriosis. I need to have my doctor at some point, or at any point, because I don't know when it's going to happen. So from there, I found a new doctor. And like I tell my followers, I'm like, it's okay to divorce your doctor. It's okay to get a second opinion. If your doctor is not able to provide the service for you, we're not a shortage. There's no shortage of doctors. We have plenty certified people that will assist you. We just have to find them. And sometimes we have to be willing to travel sometime to find the one that's for you. And you need to find a doctor that also advocates for you. Because I found that is a very, very important piece, because you may have a doctor that's, yeah, that's fine, okay, but you want one that's gonna fight for you. Like, hey, listen, this is what's coming up on your scan. I need you to come right away. I need to do further testing. Not just when I was like, oh, okay, oh, as soon as you come 6 months and like, oh, I saw this on the chart. No, I need someone that's going to advocate for me, because I don't know all these medical genres. So I need you to do that. And don't be afraid to, okay, tell your doctor, I need to speak with you. So when you call their office, instead of the typical 15 minutes, could I book 20, 25 minutes? I need that extra time to speak to my doctor. They have several patients, so they may only have allotted time to speak to you. So when you book your appointment, ask for that extra time, so they know, okay, this patient really needs that time. And it's okay. I haven't found, like, the really good ones I have teamed up with, they don't mind the advocacy. They have checked other doctors and like, I would not have given this course of treatment for this. And those are the doctors that I love, because you are fighting for us that may not know the ins and outs, because we didn't go to medical school. We didn't go there. We just know what's going on with our body. And we have heard it from other women that's going through the same thing. And we all are not crazy. We're not crazy. Something is off. And we need to find a doctor that's willing to listen and advocate for us. And they do exist. Sometimes you just have to search, but they do exist. I found a couple.
Yes.
Yeah, that's absolutely great. Actually, that's the same sort of thing that we do. We really focus on the support groups to kind of, because we have women who are women and girls, who are members of the support group. So we discuss, pertinent issues, things like, pointing out to the ladies that if you're taking this kind of medication, you need to be on calcium supplements, for instance. Did your doctor give you calcium supplements? Go back and get that prescription, because then you find that you're starting to have bone problems, back problems, because you didn't get the supplements. You realize that some people have been put on GnRH drugs for so long, over the 6-month period. Some are going on for 2 years, and the doctor hasn't stopped that. So those are the kind of things that we call out and advise. Think of going to see another doctor. And then women who are anemic, and just getting just basic supplements and things like that. And we discuss a lot of stuff. And just like Sandra said, we also advise women to think of second opinions, third opinions, and fourth opinions. I mean, if you feel the doctor is not giving you the right treatment. We know that excision surgery is the gold standard, for endometriosis care. But we know also that in our part of the world that we do not have the specialists there. So we always try and encourage women to please, if you need excision surgery, kind of look at going out of the country to be able to get that surgery, not risking to have it in, because we have some of the ladies in our group who are, it's a hot mess. I mean, it's, you've been cut up, it's really bad. So we then kind of, encourage them to try and see if they can get the insurance companies, get some funding to be able to have the treatment in a specialized place, because excision surgery is really specialized. So yeah, because a lot of people, a lot of the surgery that occurs in our part of the world is really ablation surgery, yeah, and which may work for when it's very minimal, but when it's not very deep. But when it's extensive, when you've had endometriosis for long, obviously that doesn't help. In fact, if anything, it will get worse. If after that surgery, the next time round, you feel even much worse than you were before. Yeah. So those are the kind of tips that we try and talk, and let the ladies know. And then in terms of advocacy as an organization, one of the things we're trying to do is ensure that through our Ministry of Health, that we have guidelines and just guidelines and standards for endometriosis and adenomyosis care, around in the country, support in terms of the diagnosis and treatment and also management of the condition. Because without that, a doctor in one part of is saying this, another one is it doesn't check to diagnose. There are no standards, and no guidelines. Yeah, so I think that would go a long way in helping to level out and in helping to support women with endometriosis. Thank you.
Wow. I think as a patient, hopefully everyone that's listening was taking notes, because every single one of you just mentioned 3 or 4 ways that patients can show up and improve that relationship with their doctor, or improve that relationship with the healthcare system in order to maintain wellness. But I think for the doctors that are maybe listening to this call, or, for the trainees like myself, Dr. Haben and Dr. Smitha, what can we do to advocate for our patients? What can we do to improve the experiences of people like Nenji, Sandra, Alana, Doris, so that they're not experiencing jumping through hoops and they're not feeling not listened to and not heard? How can we improve endometriosis care?
Yeah, I think this is the probably most important topic with delivering the best care for patients with endometriosis, right? And thank you, all of you, for sharing these stories. That's incredibly candid. It's real. It's my practice every single day, what I hear. Unfortunately, I wish I could say it's the first time I've heard all of what all of you said, but it's not. I hear it every day. And we know there's a delay in diagnosis because it can be traditionally thought of as difficult to diagnose with all the different types of symptoms, right? We know that there can be a 7 to 8 year delay in diagnosis, and I'm often the 10th doctor that people are seeking out as a specialist. I think that there has to be a huge change in the medical community and in general about the open dialogue and transparency around of it. So I applaud all of you for being so open and doing the phenomenal work that you're doing to pay it forward to help other people suffering with this disease and help them learn how to best seek care for it, because unfortunately there are disparities, tons of disparities here that we see. And the symptoms that you all mentioned are actually, are typical symptoms that we see with endometriosis. If you recognize it, you know it, you suspect it, and you go to surgery. It's not just history and the symptoms, the physical exam. If you've mentioned having advanced stage endometriosis, we're going to probably notice some of that on exam too. So, and over and over, it does get missed. I think that the conversations have to change at home. The conversations have to change with our younger people suffering with endometriosis, the education in schools. I mean, thank you to all of you. Doris, it's amazing. We have a lot to learn from you to change in this country too, and talk about menstrual cycle wellness, talk about what is, can be in the spectrum of okay, of some discomfort. And then, hey, when this starts affecting your quality of life, when you're missing school, when you're missing work, when it's altering the trajectory of your life, not okay. So you need to tell us when that's too much. And a lot of you mentioned that you kept fighting, and we know that. We know about this strong constitution and courage that keeps people suffering with endometriosis and pain and these quality of life issues to just keep looking. Oh, well, that wasn't okay. When you're talking to a provider that is hearing you, asking those right questions and understanding you. And the other thing is, it's our job to guide treatment options. I think someone's not muted, actually. If you guys wouldn't mind muting, but it's our job to guide your treatment options just based on your goals of therapy. So for a woman who's trying to preserve fertility, if you have someone offering you, removal of your uterus, well, that's not meeting my goals. So automatically, okay, that might not be the right provider for me. Excision of endometriosis is the standard. We have to excise it, and it can live anywhere. So it is complex, challenging surgery for our trainees. This is really important. And finding a physician, again, you ask those questions. Are you going to remove it from everywhere when you find it? Are you going to also remove scarring to restore anatomy? Are you going to remove all of the endometrioma? Are you, can I have pictures? I give all my patients pictures at the very beginning of the surgery and then at the very end. So they see everything. And that's like 20 pictures in total. I give them a copy of their pathology report at the end. They have their operative note. I mean, this is the time when you are totally making all the decisions in your care. And you should be able to do that very comfortably. It is, as you can imagine, difficult to hear these stories, and it's difficult to hear the dismissal of things that are very important to you in general as someone providing this care, because I feel like it's my charge in my career to change that as much as possible so that more and more women aren't suffering. In general, I think I agree with everything you said. Seek second, third opinions, find somebody, ask them the right questions that you need to know that they know before proceeding in your care with them, and doing exactly what you're doing now, which is talking very openly, doing the education, all of these opportunities to help more and more moving forward. I applaud all of you for doing this amazing work. Really, truly, thank you so much. and keep talking about this. I tell every single one of my patients, especially post-op, when they come back and see me, it's incredible outcomes after excision. I tell all of them, talk about your symptoms. Tell people, recognize this in your family members, in your loved ones, and create these open dialogues, because the longer we let this go, the much more difficult it is to manage. It's an evolution into chronic pain, and then also potentially infertility. And that has quite negative impacts on a person and changes them. I'm sure endo crosses your mind every single day, and your whole family's lives could be altered because of it. So we know that there's a lot more education. I hope we all continue to do this together. But yeah, I think from my perspective, all I can do is keep doing as much education as possible too.
That was great. I just want to add that speaking from kind of a more generalist perspective, especially as a trainee in this career still, I think we see a lot of patients that are kind of the undifferentiated patient. They come in with a complaint of pelvic pain, and they don't know about endometriosis or fibroids or any of it. And I think Nenji, when you described being first diagnosed with, I think you had described being diagnosed first with fibroids, and being in the fibroid belt, kind of in the South, and especially majority Black women, I think endometriosis is far from our minds when we think about pelvic pain, and it really shouldn't be. I think it's something that is so underdiagnosed in women of color specifically. And being a woman of color myself, I want to be an advocate and make sure it's something that's at the forefront of our minds. So it doesn't take 7 to 30 years to diagnose this in a patient. And I think the education piece is key. I think kind of advocating and encouraging patients to keep symptom diaries and to keep track of what's going on and when, I think is super important, because it not only helps us understand that, hey, this doesn't make sense with our other, thoughts or other differential diagnoses. This is pointing towards something else. And I think when we're able to have our patients teach us something, I think it's helpful and fruitful. And I think that it's something that's important for us to learn as trainees. Kind of going forward, I'm excited for a future and a career of advocating for women with endo, and making sure it's something that's diagnosed as early as possible.
Absolutely. Absolutely. This has been such a great conversation. I, on my side, just have a couple more questions left, but I do want to remind everyone that we are extending this talk by just about 15-20 minutes at this point. So bear with us if you still have a question. The silence surrounding endometriosis is deafening. Okay. I think all 6 of you have reiterated this, how deafening it is. And even further, when we think about endometriosis not discriminating, we know that there's disparities that are along these racial lines. I'm really glad, Dr. Haben, that you actually kind of opened up into that discussion, how I might get a patient and she's saying she's in pain and having these weird periods, and I might dismiss it and just say she's having fibroids, and think no further about maybe she's going through endometriosis. And so I'm curious, this is again a really hard question, because I think it's a big question, but as briefly as you can, to the doctors, why do you think there are disparities with how Black women and Black people with wombs are being diagnosed with endometriosis?
It's a really tough question. And for a long time, I have thought, come home and saw a woman of color with, I think it was Doris mentioning so many surgeries. I have an Instagram post of a 30-year-old who has, laparotomies, or the big incisions up and down, all the way across, multiple times, open surgeries. And it is really difficult to know exactly why. And I don't know that we know why. And I'd love to hear from the rest of the panel too. I think that there unfortunately are disparities based on many reasons. Of course, there might be differences in access or access to care, and even just information, even just knowing that I can say this isn't okay, that I'm suffering like this, and I need to continue to push forward and seek care. I really wish I could pinpoint reasons as to why I see that in my population, being in North Carolina too, that endometriosis tends to be much more advanced in Black patients. And I see that they are suffering for much longer before getting proper care. So I don't know that I can speculate as to exactly why, but these are absolutely the patient population that we need to reach and keep providing this education and encouragement and community that this isn't how you have to live your life. There are answers out there for you, and I think that a lot of it hopefully will continue to improve with education. So I know that's not a great answer and I wish that I had more answers, but I would love to hear from the rest of the panel. I want to learn and continue to know how we can help more, reach more with this condition.
I think also, I mentioned in the chat, the medical field has a long history of having a racial bias and believing pain for people of color. And I think that this is one example that we see that, and we've seen other examples in different literature in terms of medications given to, people of color with cardiac concerns and pain and things like that. And I definitely in kind of researching and reading, I mean, that's been true for endometriosis. I mean, historically, it's been more diagnosed in white affluent patients. And I think that's an error. I think that's with the bias that we aren't correctly diagnosing chronic pelvic pain in women of color. And Sandra, this is, something that I think that you had brought up, that they told you that you were lying. I mean, they told your parents that you were lying about your symptoms and lying about your pain to get out of things like school. So I think that's harmful. And it's leading to a delayed diagnosis. It's leading to more complications for, women that don't get that diagnosis earlier on. So I think that being in the medical field myself, I think I want to be someone that's hoping to change that kind of that lens, even just the act of just being in medicine myself is hoping to change that lens and widen it so that it's not so we don't think of diagnoses so much in the racial makeup that they've always been kind of set out to be. I think that that's something that those in the medical field know, it's how we're taught to kind of narrow our diagnosis is a lot of times is within a realm of kind of racial and gender norms. And I think that is very harmful. And it's, sometimes it can be helpful, but in this instance, I think it's only done harm. So I think that it's important to know that the diseases that we historically think can affect one population, we can't really allow that generalization to continue. And I do think actually more research needs to be done as well on this. So I hope to see more in the future, and I hope our field of medicine changes.
I think for us, a big part of the problem has been cultural bias. I mean, we've been culturally, girls are not supposed to talk about painful menses, and you're supposed to, you're supposed to woman up. I mean, it's not something that you should say that you're feeling pain and all that. Otherwise, it shows weakness for you as a woman. So it's for us, it's a strong cultural issue that makes it difficult for women, girls to be able to come from, forth and talk about their diagnosis, or what they're going through rather. I remember myself, even, I started having problems when I was 12, 13 years old. And I brought it up to my mom, and she actually took me to 4 different gynecologists, but they all say the same thing. Oh, when she has a baby, this pain will go and she'll be fine, and it will be okay. Then when I was in my college years, I decided to see another doctor. And I remember when I saw her, she said to me with such disdain that, I mean, how do you ever expect to give birth if you can't even stand a period? I mean, what kind of woman are you? Yeah. So from then on, I lied about my period. I lied about what I was suffering from. And I know, perhaps the doctors will say that they've seen that with girls coming in and saying that it's food poisoning, and yet it's periods. We lie. I lied constantly about it being, some food poisoning, some diarrhea. I would never say it was related to the period because I was too ashamed to talk about it. So that kind of shame is also has held many women back. They don't come out and talk about what they're going through. Yeah, but that's the culture that we are trying to change. Yeah, by coming forth and saying that, you know what, many of you are thinking about this in the context of normal periods, but there is something, as there are abnormal periods. Yeah, and these instances when there's that abnormal period, in instances when people have endometriosis, fibroids, and all these other conditions, yeah. So by publicizing that kind of information, I think it's going to be quite helpful, and maybe it might change, yeah, the outlook.
Yeah. Wow. I think you really hit the nail on the head, Doris, with that answer, and reminding us that menstrual health is not just a woman's issue, quote unquote, but it's really an issue of gender equality, social justice. This entire panel is called Endometriosis and Reproductive Justice. And, just to kind of name and define it, reproductive justice, or the RJ framework, was established by Black women. So I think it's beautiful that we have this diverse, just beautiful melanin across my page right now panel. But the RJ framework focuses on issues affecting access, which I heard Dr. Smitha talking about. It talks about, how can we just get rid of the bias that is inherent in the medical system? How can we make sure that the reproductive lives of women and trans people of color are really central? How do we make sure that we have comprehensive sex and reproductive health care education? I mean, all of this is part of the RJ framework. And without me even mentioning it earlier, all of you have answered how endometriosis is actually like the perfect, it's kind of ironic to say, but the perfect condition to talk about reproductive justice and why it's so important, not just for yourselves, but for entire communities. We are running down to the last 10 minutes, and I did want to ask my final question. Is kind of different for each of you, and we'll keep the answers to under a minute, 2 minutes for each person if they so choose to answer it, then get to one or two of the audience questions, which have been fantastic, by the way. But, for the patients on the panel, specifically Alana and Nenji, what do you wish you had known earlier or sooner or younger or pre-diagnosis about endometriosis?
I wish I would have known how much it would change my life, but also how much it would affect me mentally and emotionally. I didn't say it before, but I was diagnosed in this past surgery with stage 4 endometriosis. And so the doctor came out of surgery. This is not a knock on his bedside manner, because I'm a very direct person. So I wanted to give it to me straight. But the first thing he said to me was, "It's a disaster in there." And I said, "Oh, wow." I wish in that initial diagnosis, I would have asked more questions. I would have taken it seriously. I would have paused for my health, would have taken that pause in my career for my health, and would have done the work that I'm doing now then. And maybe I could have prevented a stage 4 diagnosis. Maybe I could have saved myself some of the pain I felt since then. I just wish I would ask more questions, and even rewind back to 2006 in my first surgery. I wish I would have taken that health issue a little bit more seriously, because then I probably would have pushed to do some fertility, some freezing of some eggs a lot sooner than when I am now in extremis with all these surgeries. So I wish I would have just taken a little bit more seriously, asked more questions and educated myself more.
Yeah, I think for me, I feel like it's sort of, some of it's already been said, but I think, I just think the education piece, I think even pre-diagnosis, getting to the point where I was in like this stabbing pain that I couldn't stand up and I couldn't move, I'd wish I had known more, had more awareness about, I think, sort of what Doris is saying in the sense of like, some of the atypical, some of the symptoms of endometriosis in essence, right? And truly know that like huge blood clots are not, like consistently are not normal, because I became anemic as a result of it as well. And just think, again, the debilitating way, I shouldn't have been vomiting, right? I shouldn't have felt like I was fainting. And so I wish had just been a greater awareness of symptoms even prior. So, I was suffering through my teens pretty silently, but just like, oh, I'm strong, I take pain, I just keep moving, right? I'm an educator, I run schools, I do all these things. And I wish someone had told me. I wish there was conversation in spaces around me. I wish even in my own family, personal circles, professional circles, that people were more comfortable sharing about their reproductive health. And I think the more I've even shared with other people, they've been like, oh, you know what, this is, again, I think it's a point people said like, oh, I have that symptom too. And I've been wondering, and I've just, and I think, I just wish there had been more education around me and that I had known, because I definitely would have sought to begin advocating even sooner before getting to a place where it just, the pain literally is unbearable. And you think, wow, I could actually die from this because I can't, this is just so unbearable. And so, yeah, I think that's one of the key things. And then I also wish I had known and understood sooner what a lot of you all have said, that it's okay to change doctors. It's okay to advocate for yourself and to really say, hey, this isn't working for me, or like, I'm not being taken seriously here. Let me keep pushing and really being transparent with my pain, and hoping that somebody will listen sooner and actually really take into account all of my symptoms. So definitely the self-advocacy, but then even just the knowledge around, what isn't typical and why, suffering sort of in silence. And last thing I will say on that, because it's been mentioned a little bit, is just that there's no shame in it, right? Like I think there's such a stigma. And so often, if I were to think about someone who just got diagnosed, like, don't feel ashamed, like, don't feel like you're to blame. Don't feel like you've done something wrong and it's your fault. I think I think a lot of the silence is because there's shame, and there's a sense of like, someone's like, oh, you have an illness, what did you do? Like, especially again, talking about people of color and Black women, it's like, oh, people think, oh, is it genetics, or oh, is it you don't eat well, or whatever it is. There's so many things people come up with and say, and I just think, yeah, I just wish sooner. I mean, fortunately, I'm a pretty strong advocate overall, but I think in the initial year or two, it was like, oh gosh, I'm ashamed. Did I do something wrong? My body's broken. I just wish I'd known sooner too, and that our young girls and young menstruators knew sooner that there is no shame, and you're not to blame, and you're not alone in this reality and in this experience. That there's a community of people out there in solidarity with you, and who you can lean on through the journey. So.
For Doris and Sandra, a little bit, almost similar, but a little bit different, as two survivors of endometriosis, now with an organization, how can people support your endo space, number one, very briefly, and then, for kind of going into some of these audience questions, how can organizations make themselves more available for women and people who think they have endometriosis?
Okay, I can go first. For us, well, supporting the organization in terms of, first of all, to move on even with our work, I mean, one of the most difficult things is actually just getting funding for the organization, because really nobody is funding this kind of work. We have an MHM policy in Kenya, but the focus of MHM is really more on sanitary products, facilitation and services and all that, but not on the aspects of menstrual disorders and endometriosis and issues like that. So it's become very difficult because most funders are not giving money for that. So that's been a real big challenge, which of course has impacted in terms of how we can support even the members, even the ladies who look up to us to help them and to who seek support, especially for medical care and that kind of issue. So yeah, so that's I think for me the appeal would be to the funders and to the policymakers out there to see that the narrative has changed, that MHM, especially in the wider space, because MHM is the big thing now, you know, the menstrual hygiene management issues. And there's a lot of money that's coming in for the sanitary pads and all that and the products. And I think it's time they start thinking about including menstrual, you know, issues to do with menstrual wellness, menstrual health, menstrual disorders education, so that then once they start funding that, once they start including that, then money would be available for the rest of us in terms of helping us to achieve the work that we're doing. We have platforms, we are, you know, on social media, we have our website, we have, you know, the Instagram, Twitter, everything. And we are very accessible to, you know, to women. I mean, we do a lot of social media and TV interviews and things like that. So people really know us quite well. So it's so easy to join our group. It's so easy to contact us. And we always have people, you know, women asking us and girls asking us about issues. And so we encourage that kind of interaction. Yeah. So, yeah. So I think maybe that's the most I can say about that.
Yeah.
Thank you.
And right before Sandra answers how we support her, because Dr. Vilasagar has to leave us for the evening. We're right up onto that hour-and-a-half time. I did want to let her answer one of the audience questions that came up multiple times privately and publicly about what are the different stages of endo. And when we kept saying, you know, stage 4, like Alana now has, and stage 3, etc., what that actually means. So before you leave us, can you do that?
Yeah, that's an excellent question. Happy to stay for a couple and answer that. So traditionally, endometriosis was staged much like we see with the cancer diagnosis, and surgically, those of us removing it know that it follows no rules, much like cancer also can infiltrate anything and causes really this really quite significant scarring and process of fibrosis and sticking everything together. Stage 1 involves lesions and these cells that implant in smaller sizes and superficially on the lining or the covering that we all have, covering all the organs internally. And then it progresses to stage 2 and 3 and 4 as it progresses onwards and advances. And that is typically due to the combination of endometriosis cysts, endometriomas, which are insanely inflammatory and stick to everything around it, which is typically the back of the uterus, the rectum, the sidewalls where the ureters are. Those are the tubes that carry urine from kidneys to the bladder. So very important blood vessels, nerves, structures everywhere. And so we see it progress from the superficial disease to this advanced stage 4 disease, we call it, which is a frozen pelvis, everything cemented together. And stage 3 and 4 are typically involving those endometriomas. So when we hear about chocolate cysts and endometriomas, the first thing we start thinking about is, well, where are they in their advancement of disease, and what's the surgery going to be like? Are we going to be involving, you know, doing bowel surgery or anything else? And routinely living around all of these structures and the, as I mentioned, the sidewall structures like the ureters. You guys are all very well versed with all of these anatomic structures, I know, because you educate yourselves and know about where endometriosis lives. So those are the stages. One thing I want to mention with the stages is that doesn't correlate to your symptoms. It doesn't mean that because you have stage 1 disease, you're barely going to have symptoms, or you might just have a little pain with your period. Or if you have stage 4 disease, you're going to have the worst debilitating pain in the world. It does not mean that. And so I'm not routinely staging every single surgery, because what does that mean in the future? I describe everything, every single finding as descriptively as possible. And I will always comment on stage 4 disease, because that will potentially impact a future surgery if there is one, and know that, well, there could be bowel involvement. There could be potential of a bowel resection. And just as we've talked a lot about the approach for care of endometriosis in the outpatient setting being multidisciplinary, involving mental health, involving every system and making sure, we touched on physical therapy, sex therapists, just making sure we're covering all aspects. It's really important in the operating room to have a multidisciplinary approach and a team approach too. So us as doctors and surgeons hearing our patients, hearing the symptoms, if you're telling me about the severe rectal pain, well, then the next question is, are you having blood in your stool, especially during your period? And is that then going to prompt a colonoscopy preoperatively and me predicting or, knowing based on your exam and the questions and the history you're giving me that I might be expecting stage 4 disease based on a lot of things. So, just important to know that even with stages, that doesn't mean that is going to equal the extent of the symptoms that you're having. Very mysterious condition and enigmatic, and we're learning more and more and more about this.
Thank you. Wow, that was, and you also answered the question that I was potentially going to ask the doctors too. So I actually am going to, just because I'm talking to the doctors, go to Dr. Debessai, and then we're going to end with Sandra answering a couple questions as well. So Dr. Debessai, what do you want your patients to know about endometriosis? For people listening right now, we have a few of us still here, but for those that are going to watch this recording, this is too many gems were dropped tonight. But what do you want patients to know when they come to you? And you're muted.
Sorry, I keep doing that. I was going to say, I think for me, one of the biggest things that I learned from this panel, and even just from listening to everyone speak, I want my future patients to feel like they can advocate for themselves. And also I want them to be heard. And I think that what I've learned from this talk is, one, I want to be a better listener, but I also want to encourage my fellow colleagues to be better too. And I think that this disease and the way that it can be so debilitating is it's a struggle, and it's difficult. And I think that making sure that when we hear that maybe a patient has this diagnosis, knowing and understanding that they might have a lot of symptoms they need to go through, and that we need to hear that, and we need to make sure that we're addressing each one. I think also for me, I want to also, I said it before, but I think also address that there are biases, and I want to actively address them and bring them up. And it's something that I'm hoping to actually to even bring up to our department and see if that's something that we can address within our department and within my cohort. So I think that I just want to be a kind of a megaphone for this issue even more.
Absolutely. Absolutely. And Sandra, very similar question, and kind of to take us out for the hour and a half of this incredible discussion. How can any of the people listening right now, so those that, might have insurance, might not have insurance, that are frustrated because of their pain or think that they're about to be diagnosed with endometriosis, how can they find support? What would you recommend for them? And, in addition, just how can we support your organization, which is Filling Empty Wounds?
One of the things I tell everyone is that own your story. Own your story. It may not be beautiful. It may have a lot of scars in it, but it's your story. Own it and keep saying it until someone's listening to you. And I couldn't guarantee eventually you're going to find someone that's just like you, someone that's going through it, and now you giving them permission to also tell their story. So own it regardless of how it looks, and tell your story in the midst of your tears. It doesn't matter. It needs to be told. So advocating, educating is something that I'm heavily about, because I wish I knew more when I started this, and I don't want someone else having to wait 20 some odd years, 30 some odd years when they're ready to have children and find out I have endometriosis. And it got to the point I stopped mentioning that I had endometriosis to doctors, because it was like, what's the point? You're not going to listen to me. Like, what's the point of me rehashing the story for nothing? Because nothing's going to come out of it. So Now I tell them, keep sharing, keep telling your doctor. And if you can't find one, find someone else who listen. So one of the things that we have under our umbrella is the acronym SAVE, which is the acronym Support, Awareness, Financial, and Education. This is something that we have to give to our community because we don't want another little Black girl having to go through this and being told, oh, you just don't want to go to work because you're in pain. You're calling sick because you just don't want to work. No, she's calling sick because she's truly in pain and no one is listening to her.
Wow, this panel has been so incredible. I just looked at the time and realized time went by so quickly. We've been talking for over a little bit over an hour and a half. And so I want to be respectful of everyone's time and also just send a great deal of appreciation. I do want to just do a brief recap, themes that I heard from every single panelist. Number one, advocate for yourself, speak up, document, keep notes, ask questions, and for doctors, make sure that you're providing questions and notes and answers. Number two, take care of your wellness and your mental space and your soul, because endo is much deeper than just pain. It's really about making sure that you are in a mental state of support. So whether that's finding a therapist, whether that you need to, talk to a psychiatrist about elevating to medications or whatnot, really doing your due diligence in that way. Number three, finding places that are educating. And I'm so glad that, I'm here as a Black OBGYN project. I'm trying to bring together organizations. So being able to learn of, filling empty wombs and learn of Endo Sisters East Africa is so empowering, to partner with organizations like Period, where we realize that menstrual health and well-being is actually all systemic health and well-being, and educating both doctors, policymakers, communities about it, talking to our girls and boys about this early so that they are aware of it early. It sounds like a huge theme, and there was so many other gems, but those are the ones that popped out at me. I just want to say thank you to each and every panelist here. I know Dr. V had to leave a little bit early, but it has been so humbling. My heart is so full. We could have talked all night, ladies. Honestly, you've challenged me as a doctor to do better. You've challenged me as an advocate to speak louder. And for that, I thank you. And I hope our participants and our audience feel filled as well. We're definitely going to continue these type of conversations. We're going to have another endo talk, because obviously there needs to be a part 2. But I do want to shift over to Doris, who is the National Program Director of Period, to help close us out. And then we will continue these conversations in the future. So do look out.
Awesome. Thank you so much to each of you. Thank you for those of you that are still on. I am excited to share. I got some messages asking me if this is going to be recorded, so it is. I'm just happy to share that Period is really committed to having conversations like this available to the public for free. And we are happy to share that honorariums are always offered to our panelists as well. So this is a quick reminder to really continue these type of events that are so important, to consider donating to period.org/donate. if you are able to. With that, I just want to say thank you. You can find us at Period Movement. You can find the Black OBGYN Project at the Black OBGYN Project, and we will send a thank you email with some of the contact info from our panelists, as well as their websites for their orgs and handles if they're interested, so that you can continue connecting with them and continue this conversation. So with that, thank you again so much, and we're excited to connect in the future. Thank you all.